All right, welcome everybody to our integrated eligibility webinar series. This is the 10th one in our series, and today we are once again talking about how community partners need to provide the rights and responsibilities and the notice of privacy practices to all of their applicants. We also delivered this webinar last month, but we have learned a lot in the past month, and we wanted to make sure everybody had access to this topic. So we planned and are delivering it 2 months in a row, September and October 2021. So here we are. We will go through the content. We'll have plenty of time for questions. And Jessica Diaz from our CPOP team is managing questions. So she will either interject for clarification when needed or save your question for later. So if you don't hear it asked right away, don't worry about it. She'll either be answering it in the chat box or she'll get to it at some point. Or if we don't know the answer, we may have to follow up with you, but we are not ignoring you. All right, next slide. So past IE webinars, we record these. We post them on GroupSite. They are in the trainings section under additional training resources, and we have put a link here for you. So that is where you can access the recordings as well as the slides. And today we have some objectives. We're going to take a deeper look at the rights and responsibilities and the notice of privacy practices and what tools you have as community partners to provide them to all of your applicants. We'll talk about what they are, why they're important, what CPs need to do, where to find these documents. We'll talk about some tools and parameters to help you provide them. And we'll talk about the requirement to document your organization's standardized process. And maybe I shouldn't say standardized, but your process for making sure that each applicant gets these documents in whatever way works for them. So I'll take out the word standardized later. And we'll have plenty of time for Q&A. All right, so the first thing I want to start with is that rights and responsibilities and notice of privacy practices is a very big mouthful. So we are going to use the acronym for short, R&R and NPP. You will see this throughout. I don't know if I'll say it or not. We'll see what happens. But if you see R&R and NPP, that's what we are referring to. Now, here's the context. When somebody applies on a paper application, they are looking at the R&R and the NPP throughout the paper at the end of the paper application, and it comes with the application guide, which they also have, and they are provided those documents. When they are applying in the applicant portal, those documents and the content of them are spread throughout the applicant portal application. They see them as they are applying, and at the end they sign to them. And workers provide these documents to all applicants, even if there is a phone application. But what happened was our hearings unit reported concerns about members not always seeing what they were signing, especially when it came to when they were working with community partners. And it made us realize that as an agency and as a program, we must ensure that applicants receive this information regardless of how they're applying. It must be the same across the board. So that's what today is about. So a little bit about what they are. The rights and responsibilities and notice of privacy practices. The rights part of that, it lists what the Oregon Department of Human Services and Oregon Health Authority agree to do for clients, right? The client's rights, the things they have a right to, and we'll go into some examples in a moment. There's also responsibilities, which outline the applicant and member obligations. They have some obligations and some things they are agreeing to when they apply for benefits. And then the second document is the Notice of Privacy Practices. It outlines how we use the applicant's data and their social security number and when we might share their data. That's really important for people to have access to and for them to be notified about. And we'll take a look at all of these documents. But the long and short of it is that applicants need to know what they're signing and agreeing to before they sign. And we can't make that decision for them. We can't think, oh, it's probably not that important to them. I'm not going to show it to them. I'm just going to have them sign. Right? We certainly wouldn't want somebody to do that for us. Everybody gets to make their own choice about how much they read those documents. Our job as community partners and an agency is to provide those documents. And that is easier in person than it is remotely. So we'll talk about those different ways of assisting. I do want to point out that when people sign the paper or PDF or the applicant portal, it has language in there that says, and I've highlighted it, I understand and agree to the rights and responsibilities as explained in this application and in the application guide. And I have read and agree to the OHA Notice of Privacy Practices in Appendix C. Now, those documents can be found other places too, and we will show you that. But the core of it is that they are signing that they understand and agree to these documents and that they have read and agreed to them. So it's our obligation to make sure they are provided these documents. Here's some examples of the applicant's rights. They have a right to be treated with respect in a fair and polite way. They have a right to ask about and apply for any of the programs. They have a right to ask for a meeting with a worker or a person in charge. They have a right to ask for help in their application. They have a right to know the agency's decision-making timeframes, to ask for information in a format or a language that works for them, or to meet their needs if they have a disability. And they have a right to appeal an eligibility decision. That's a big one. Right? They don't have to just take what the agency says, but if they don't agree with it, they can appeal that. We actually have a whole webinar on that. So we have linked that webinar in English and Spanish. It's about the grievance system and members' rights. So please refer to that if you'd like more information. But there are many more things included in the applicant's rights. And we couldn't possibly just summarize it because it's really long. So they need to receive the full document, which I know people have some thoughts and feelings about, but it is what it is. Examples of applicants' responsibilities. They are signing and agreeing that they have and are taking on the responsibility to give true, accurate, and true, correct, and complete information. They are agreeing to give proof of certain things if we need proof. They're agreeing to report changes. They're agreeing to pursue other resources, meaning like applying for and using other benefits or money that they might be eligible for or entitled to. They're agreeing to estate recovery if they end up in the long-term care program. And the rights and responsibilities outlines when that applies and when it doesn't. It doesn't apply, it only applies to long-term care services, but people need to know about that. They are agreeing to authorize release of child support records from the Department of Justice unless there's good cause. Like there's some stuff in there that people need to know about that they are agreeing to. So we just wanted to let you know some of the things that are in there so you can understand the importance of it. And of course, there's much more. This is actually not a new requirement. It has been a requirement, and it really wasn't an issue when we were doing exclusively in-person assistance. But since we moved to remote assistance, it highlighted that we needed to provide more tools and more guidance to help you as community partners. So that's what we're doing here. All right, I want to take a moment to pause and see if there are any questions or clarifications that we need to make.
I think the questions we have relate to where you're going next, so keep going.
Excellent. So there are some core things that community partners need to do, and we are hoping to outline them very clearly here. So the first thing you need to do, and you might want to bookmark this this slide or print it out, but there's also a guide. It's about, I think, 3 pages, and it's also attached to your webinar control panel, and you can grab it from GroupSite. And the guide also outlines these 4 things that you need to do. The first thing is you need to tell the applicants that they will be signing, that they understand and agree to these 2 documents. And then you need to provide both of these documents to the primary applicant, and that's the person signing the application. So it doesn't need to go to everybody, just the primary applicant, but it must happen before they sign. Now, I've put some links in here to what we think is the easiest way to access these documents. So for rights and responsibilities, the full set of those for the medical is contained on pages 11 through 16 of the OHP application guide. And we've put a link to that guide. For notice of privacy practices, it's a separate form, and you can pull it up from the form server. You can pull both of those from the form server, and we have put links there. Okay. So that's the second thing you need to do is provide these documents. The third thing you need to do is review the application information with that applicant prior to submitting. And we'll talk about some of the ways that you can do this that hopefully do not make it very onerous. We're trying to make it as easy as possible. But you do need to review that information before they submit so they can make any corrections before submission. And then you need to tell them that it is their obligation and they're agreeing to report changes within 10 days. So there's two pieces in there, right? Review application information and reporting changes. And the last thing you need to do at the organization level, this is not at the individual applicant level, but you need to document your organization's process for providing these documents and for reporting changes. And we'll give you examples of documentation. So we're going to go through some details about these things that hopefully will clarify some of the questions you might be having. All right, so if you're providing in-person assistance, as I alluded to before, the rights and responsibilities and notice of privacy practices are shown in various sections throughout the applicant portal. So as long as somebody is sitting there with you and reviewing all the screens during that application, that meets the requirement for providing these documents. Now, outside of this scenario, it becomes a little bit more complex because the paper application, for example, does not have the full rights and responsibilities in it. So you do need to provide an extra document. So outside of the in-person applicant portal scenario, we're going to go through some other options. Now, right now, one of the most common scenarios is remote assistance, and that is the most complex. So if possible, we are discovering that the best thing to do, if you can, is to send these documents to an applicant before the application appointment. That can be in various ways, right? You can send them a paper copy, you can send them screenshots, you can send them a link through email or text, you can send them a document attachment through email or text. But if you can, and you send it beforehand, then during the appointment, you can simply say, have you reviewed the documents I sent you? And if they say yes, then you're clear to go. Now, they may receive these documents in various ways, right? You can show it to them on a screen, or they can view it on a screen of their own. You could provide laminated sheets prior to the application for them to review before they sit down with you. You could provide paper copies prior to the application, and certainly they could take those home if they wanted. You could read them out loud to the applicant, but I'm guessing you're not going to want to do that. They're fairly lengthy. You could send the documents to the applicant to review before their appointment in one of those ways that I talked about. And you can do that by sharing files or a web link through email or text. So those are some of the ways that we have come up with, but I'd like to ask folks who are attending today, especially those who have already been doing this, are there any other methods or ways that you're sharing that are working for you? Maybe Jessica, you can share anything that's coming in through the chat box.
We do have a question about whether DocuSign can be used to send to send things like the consent form, rights and responsibilities, etc. And I got some clarification from policy that at this time we can't support DocuSign within the agency.
And that's for a signature. But I would say that I'm not sure we're limiting people regarding the format that they are sending the rights and responsibilities and notice of privacy practices to. Or I didn't say that right, but the way that you send them, we're not specifying the way they must be sent, except that they must be sent. So if they're sent in a PowerPoint presentation, or if they're sent in some other program besides a PDF, there's other ways to do it. And they don't need a signature, these two documents.
That's a good point. And I think the important thing there is it needs to be sent in a way that the applicant is able to access it.
Yeah. Yes, exactly. So, if DocuSign was a good platform for just getting people these documents, by all means, I would think that's because we're not collecting a signature. So DocuSign, we're not approving that for signatures, but if that's how you want to deliver a block of text, that's something we could certainly confirm.
Mm-hmm.
Anything else?
Let's see, we're getting some more. I think we're going to talk about audio.
Yeah, there is a note here. So I'll talk about it right now. The workers, when an applicant calls for a phone application, do have access to audio recordings that they play for the applicants. Those are being made available to us, and we are just trying to figure out how to make them available to you. So at the end, I would like to take some time to ask you or actually, you know what? Let's pause and do that now so we don't forget. We are going to be providing audio files. How would you like to receive them? As a file on your computer, as a web link? What would be useful? If you can type in and give us some feedback about how to receive those audio files. One idea is also to put them on YouTube, just with basically a blank slide, or not a blank slide, but just one title slide that says rights and responsibilities and notice of privacy practices.
I think a lot of people are saying just a way to get the audio file directly to them so they can play it on their computer. YouTube would be nice as well. It would be nice if there was a phone number people could call in to listen if they don't have other options. Web link, email, or a file it can keep. Question about multilingual audio files and their availability.
Yes, those will be available as well.
An audio file that can be sent via phone, web link.
What I'm hearing is that providing them in a variety of different ways might be useful. They might be really big files, so posting them online that you can grab and play, or share a link would that work? Would a link online that you could grab and play or grab and share be a workable solution?
Another call for that phone number that people can call directly. Both sound great. I think, yeah, most folks can access an MP3 file, which is a pretty common audio file, pretty well.
Okay.
We do have audio files in multiple languages that will be available. So getting some answers on that. And policy is curious about, so if you have a file on your computer, how would you make sure that the applicant can hear it?
Be great to get some feedback on that. That's a really good question. All right, Jessica, let me know when we should go on or if we should address some more things that are coming into the questions box.
We still had people asking questions before this prompt, and now they're behind a lot of others. So maybe I'll triage while you continue, and we can return to them.
Sounds good. And maybe we'll answer some of those questions.
Yeah.
All right. So what we want to let you know is that in the past, we've told you all the different places you can get these documents, but we decided that we wanted to start simple and let you know that together, these two forms, 9025 and 2090A, are a complete set. And the 9025 is the application guide. The rights and responsibilities for medical are specifically on pages 11 through 16. And 2090A is the notice of privacy practices, which is a standalone. So we are hoping to make a combined document for both of these, but right now it's two documents that you need to get to your clients, or rather your applicants. In fact, let's see if I put, so what I want to do right now is go into the Forms server and show everybody how to grab these, because the Forms server is where you will find them in all of the same languages as the OHP application. So instead of just linking you to the English version of the form, I want to show you what all your options are. So we're going to go to the Forms server, theory here. Oh, come on. Open, please. And we're going to go search for form 9025, and that is the application guide. Oh, it took me straight to the application guide. We're going to do a little tour of that to start with. Okay, so this is the application guide. You can see in the table of contents, if we scroll down, we have read and sign, step 8, page 11. So if we go down here to our little page guide, we can, it's funny. Oh wait, I'm making it bigger. We can go to page 11 and make it not so big. And we can see that there is step 8, read and sign, your rights and responsibilities. So here it is in the application guide. It goes for a few pages, which is probably why you might not want to read it, but you could. So pages 11 through 16. I'm going fast because we're not going to review every piece of it, but it goes all the way up until we get to Appendix A. Appendix A is for Medicare, but if we can, so that is not relevant to this. So that is what it looks like in the application guide. And now I'm going to go to the forms server, which is, I probably have a link for this in the presentation too, but I always type in OHA DHS forms server. It's the first one that pops up, shared systems.dhs OHA. This is what the forms server looks like. I'll make it a little bigger for you. And we can type in, we'll type in the 2090A, which is the Notice of Privacy Practices, 2090A. And scroll down and search. I guess I have to do 2090.
Yeah, it's just 2090 on the form server. Sorry.
Thank you. I should have known that. I'll forgive you though, O'Donnell. That's okay. Donald had nothing to do with that. So we have 2090 as the Notice of Privacy Practices. You can see that it is listed in a bunch of different languages. And we have even one just for the Oregon State Hospital. We have 2 pages, so you can keep going. And we will go back to the English version and take a look at it. DHS OHA, Notice of Privacy Practices in English. We will click that. And we will say, click to view the highlighted document. And then we will open up that PDF. And here it is. Your rights, your choices, our uses and disclosures, and it is for 5 pages. It does have some similar language like rights and responsibilities, but it is specifically about data. But it's the one with the black bubbles, the black circles. That's the Notice of Privacy Practices. So that is what they look like. And now I'm going to go back to our programming. So together, the 9025 and 2090 are a complete set. There are other ways to get the documents, and we wanted to make sure you had access to those. So we just showed you how to do it in the forms server, but you can also request them from the One Customer Service Center. You can request them via phone, the main line or the CP line. You can request them through email at oregon.benefits, and that email, I want to remind everybody, is for community partners and for members. You can request them from a local ODHS office, and they are also online, combined for all programs in English or Spanish. There's a link right here. And the Notice of Privacy Practices is Appendix C of the OHP application. So these are some other places to find these documents. But I'm going to go back one slide and say this is the easiest place to get this set right here. All right. We took a look at the application guide and the read and sign section. So that's where we found the rights and responsibilities for medical only. And we took a tour of it. We took a tour of the Notice of Privacy Practices from the forms server with all the different languages. Those are both in all the languages. All right, so after this, we're going to talk about reviewing applicant information. So I want to take a pause and ask Jessica to read some questions that we can answer about providing these 2 documents.
Yeah, and there's a lot of questions along the same line, so I'm gonna say some statements to get us started, which
Great.
is that there's folks who are concerned about making sure they know all the right form numbers and concerned about remembering them. And the good news is that we have put all of that information into the guide that is attached here in the handouts.
And which I will pull up right now. So this is the guide. It gives you all the links. It tells you what 2 documents you need to supply, and it gives you links to those documents. It gives you all the different ways you can share them. And if you're assisting in the applicant portal in person, it's all there, and other places to find these documents. So that first page summarizes where we have come to so far in the presentation.
Yeah, so I recognize that this is a lot and we're throwing a lot of numbers at you, but we did make sure to put them all in one place so that you don't have to do any memorizing or tracking it down yourself. So I hope that helps. And we also have a few different folks who are asking, how do people sign this? And I think that is worth going over because there's no separate signature for the rights and responsibilities. This is what people are signing when they are signing the application itself, that they understand and agree with the contents of these. So it's the signature on the 7210 or on the application itself that asserts that people have seen this, that is part of the process of putting in an application. I don't know if I worded that the best, but I wanted to make sure we talked about that because there is confusion.
Great point, thank you. All right, what else?
I think those are the main.
Okay.
Let's see here. Yeah, there's some trickier ones we're working on in the background.
Okay, great. Then I'm going to move on and move us along here. All right, the next piece is reviewing the application information, right? So this is actually step 3. The number 1 was tell people they're going to be signing to this stuff, provide their documents, review application information. So this is that third piece. The core of it here is that clients must know what is being submitted for them so they can make corrections and report any changes. And they need to see or hear what is being submitted for them or about to be submitted for them before it's submitted so they can make any corrections initially. Now, that can happen in various ways. If you're in person, the applicant can view that application data on the screen as it's entered. They can also look at it as a summary at the end. That's for in-person assistance, right? If you're assisting remotely, the community partner can repeat each answer back to the applicant to confirm. The applicant says, "Oh, I make $250 a week," and then we can report back and say, okay, so what I'm putting in here is that you have a weekly paycheck of $250. And then we can just make sure that we're getting it right. You could read the summary at the end of the applicant portal application. If it's possible, I don't know how common this is, but you could screen share so the applicant can follow along visually. And there may be other ways to do this as well. So does anybody want to share how they are providing or reviewing the application information with applicants if it's something other than what is here? If it's a paper application, you could make sure they're following along with you and that they visually review it. Jessica, are there any other suggestions or ideas?
We don't have any, let's see, for remote screen capturing the summary page and emailing it to the client for review.
Okay. Great.
Virtual appointments where I screen share the application with the clients.
Perfect. If that's going to work, that's a great way to do it.
And then we got some more questions we're working on.
Okay. Excellent. Now, here's another piece of this. If requested, you as a community partner must provide the applicant a copy of the submitted application. There's a little typo there with that C, which we'll take care of. You must submit a copy, or you must provide a copy of that submitted application for them if they would like it. If it's a paper application, you can make a Xerox copy and give it to them. There's other ways to do it, but we wanted to show you in the applicant portal how to pull that up. So in the applicant portal, when you're on your dashboard, you have a bunch of tabs at the top. And if you go to the My Actions, you will be able to, it's so funny, I don't love this screenshot, but if you go to the My Actions tab, you will be able to print a copy of the application information. And you can save it to PDF. You could send it to that applicant. You could print it and hand it to them. But it's under the My Actions tab, which isn't very intuitive, so we wanted to point it out. Jessica, do you want to say anything else about that before we move on?
Yeah, any applicant portal submissions you put in for any case shows up in My Actions. So that's a sort of hidden location to get a whole bunch of information that might be useful.
Great. All right, if you are assisting on a paper application, we just wanted to make a note that you should be sure to make a copy so you don't give away your only version. And that is for a bunch of reasons. One of them is that you are required to keep copies of all of your application information for 6 years, either electronically or as a hard copy. So if somebody fills out a paper application, you need to keep a copy of that in your files for 6 years. So for records retention, you need to keep it. But also, there may be cases where you need to work on the client's behalf with the processing center, with the workers at the One Customer Service Center, to clarify application information or do other actions on the case where you'll need the information from that application. So be sure to keep a copy or give the client a copy, either one. All right, the next thing we're going to cover is sample talking points for how to talk to members or applicants about these different pieces. Jessica, before we do that, are there any questions we want to address?
Let's see here. We got some answers on. So someone asked if someone is applying on behalf of a deceased person. And then in that case, who needs to see the rights and responsibilities in the notice of privacy practice? And the answer is whoever is signing. So whether that person is someone who would normally be in their household or not, if they are signing the application, then they also must have access to and understand the rights and responsibilities and privacy practices. So that's some clarification we got. And I think we have some other ones that are gonna hit with things that we talk about later. So I'll triage further.
Sounds good. All right, then we're going to share some sample talking points. First, for providing the two documents, the R&R and NPP, and then for reviewing application information and reporting changes. And all of these sample talking points are also in that 3-page guide that is uploaded to this webinar and available on GroupSite. All right, so here's some sample talking points. You can change these based on what is appropriate for your organization, what is appropriate for your clients that you're working with, but this is just an example, okay? When you sign the medical application, you agree to a set of rights and responsibilities. One of your rights is the right to an appeals process if you don't agree with your eligibility decision. One of your responsibilities is to report changes within 10 days. You are also signing an agreement with the Notice of Privacy Practices, which shares how ODHS uses your application data. I can provide these documents to you on paper, electronically, or verbally. If you have questions, you can talk to your local ODHS office, the One Customer Service Center at 800-699-9075, or you can email oregon.benefits@dhsoj.state.or.us. So that's the kind of dialogue that we would want you to have with people. You can change the language depending on what you think is appropriate. If you don't think that giving examples of what rights and responsibilities are, you don't have to. It is important to tell people that they need to report changes within 10 days, so this is a good place to do it. But we really leave this up to you to some degree. We just wanted to give you guidance in case it's helpful. When it comes to application information and reporting changes, I'll read these out loud as well, but it's the same principle that if you need to change them, that's fine, but this is just some guidance in case it's useful. It's important to know what information I submitted for you to make sure it is true and accurate. That is why we reviewed your answers before we submitted your application. By signing this application, one thing you are agreeing to or have agreed to is to report any changes to ODHS within 10 days. A community partner can help with that, or you can go to your local office, or you can contact the One Customer Service Center directly. Wait times may be long, or you can report changes through your own applicant portal account at one.oregon.gov. So This is just letting people know that they are responsible for reporting changes. They have many ways to do it. So hopefully that is helpful. All right, and then we're going to go on to documenting your process in a moment. But Jessica, are there any questions that we want to answer before we move to the next section?
We have a great question, which is, can we get this in Spanish? And I bet we can get the whole guide and talking points into Spanish pretty
Absolutely.
quickly.
And this is, yeah, in fact, we do these webinars in Spanish 2 weeks after the English version. So our one of our team members, Fabi, is responsible for that, and she will be offering that. So it is posted on group site. You can certainly register for it, and 2 weeks from now is when those Spanish materials are expected to be available. So yes.
And we also have a community partner reminding us that we should probably work to avoid acronyms in our talking points to help people understand.
Good point. Thank you. All right, anything else?
I think we can move on for now, and we have some things we'll circle back to.
Great. All right, and the last thing you need to do on those 4 bullets in the beginning, 1, 2, 3, 4, is you need to document your organization's processes. So we are not asking you to document each individual having received this information. We're not asking it at the individual level. But as an organization, we want your main contact or your manager or whatever to document how the certified assisters on your team provide these documents. And it doesn't, it's going to be different for each client, right? So you can figure out what works for your organization and for your applicants, and just document how you make that happen. You also need to document the fact that you review application information before submission, and you need to document how you track and report changes. So that's a big thing that we haven't really talked about before, which we will talk about in a moment. And I'll tell you where this came from in just a minute as well. You need to keep your procedures updated and note the date of any changes. And you should contact your regional outreach coordinator for questions or help. We are not going to ask you to provide proof of this documentation within your organization, but you should be ready to provide it if we request it. So please get together with your teams, get together with your main contact and say, hey, we need to make sure this is on file, that this is in place. Let's make sure this happens as a team so that we are in compliance. All right, here's some sample documentation. And this is just a sample, and all the details in here might be very different based on what you're doing at your organization. So please take this with a grain of salt. I think what I'm trying to show here and what we are trying to show is that this does not need to be a lengthy book on your documentation, on your process. It just needs to be something in writing that shows what you do. Something like, our organization ensures each applicant reviews both the rights and responsibilities and the notice of privacy practices before signing the application. We alert applicants they will be signing and attesting they have read and agree to these documents. Our new assister orientation includes the CPOP Rights and Responsibilities Guide, and we regularly talk about these procedures at our team meetings. So we're trying to make this low barrier, hopefully. The agency really wants some level of documentation, but we're trying to show it doesn't need to be incredibly extensive. Here's some documentation for application information and reporting changes. Let me just look forward for a second. Yeah, okay. In fact, I'm going to talk first about the fact that members are responsible for reporting changes. It's their responsibility. If they report it to you, that is not fulfilling on their responsibility until you have reported it to the agency. So if your sister organization is unable to report those changes, you need to let the member know that they must report them in another way if you can't make sure they get to the agency within that window of reporting. So they can, you need to let the member know that they can work with another CP. They can report to their local Oregon Department of Human Services office. They can call the One Customer Service Center. They can report changes to the applicant portal or their own applicant portal account, or they can email changes to Oregon.benefits email. So we just want to make sure that you all know that it's very important to help applicants understand that it's their responsibility, and give them other options if you're unable to do it. So along those lines, we have some sample documentation for doing this. Something along the lines of, our organization reviews all application information with the applicant before submitting and providing a copy. Oh, this got mucky. I'm sorry. I need to rewrite this. There's some typos in here. Our organization reviews all application information with the applicant before submitting. We also provide a copy of the submitted application upon request. We offer to report changes for clients on OHP cases. We alert clients it is their responsibility, and when they sign the application, they agree to report changes to Oregon Department of Human Services within 10 days. We offer to assist by reporting changes on their behalf. Members may call, email, or text us, or whatever, however you let them do that. We record the request in our client management database or whatever your recording system is. So state how you record that request, and state what you collect. So we record that request in the record for each client with a date of member interaction along with the date of submission to ODHS. We report changes to ODHS within however many business days is your procedure. If we're unable to do so within that time frame, we ask the client to work with another community partner or contact Oregon Department of Human Services directly. This guidance is included in our new CP orientation, and we regularly talk about it at our team meetings. So that's the kind of documentation that the agency would want to see. All right. Are there any questions, Jessica, that we should address right now?
I think let's maybe go to the end and then hold some time, perhaps.
Okay. Speaking of the end, we're basically there. All of this information about what community partners need to do, which is tell applicants, provide the documents, review the application information, and document your process, is all in this 3-page guide. So what we want you to do is review this guide, and also know that it's in the Getting Started guide. So we have a new Getting Started guide that was launched through our recertification training this year that hopefully you all have. But if actually, I'm going to guess you don't all have it, and here's why. We learned yesterday that only about 1/3 of our community partners have completed our yearly recertification training that you need to maintain your active assister ID. And in that recertification training, we go over rights and responsibilities, and we also provide the new updated Getting Started guide that includes this. We learned that approximately 2/3 of folks haven't taken that, so there's a little plug for our recertification training. But the other thing you'll need to do besides take that training is take this guide back to your team and work on documenting your procedures and your process, and be ready to share that documented process if asked. We did update this guide recently to make it more readable and more plain language and a little less complex and dense. So if you have any versions from before October 25th, please recycle those old copies. And I'm going to go into that again to take a look at it. So we have the first page, which is providing the 2 documents. The second page is suggested talking points for those documents and reviewing application information with the applicant. We have some more suggested talking points for submitting information and reporting changes. And then the third page is about documenting your organization's procedures. And this is all the same information that was in the PowerPoint, but condensed into 3 pages. And there it is. So that is the conclusion of the content from today, and I would like to spend the rest of the time on questions.
So we got a host of questions about recertification, but I wonder if we want to focus on this first and then maybe we can
Yes.
stop the recording and talk about recert because that's a
Perfect
different
plan.
topic. Let's see here. Sorry, we have a lot of activity. All right, it was mentioned, but can you please clarify, once we've documented our process, do we need to document when and how we've provided these documents to each client, or do we just need to have our process documented, not the individual clients?
Correct. You just need to have your process document that you do this. You do not need to document for each individual client that it happened or what date it happened on. We trust you as a community partner organization that if you are saying you're doing something, you are doing it. So it's the saying you are doing it that is important to us, not the proof at the individual applicant level. Hopefully that
Is
makes
that a
sense.
little different for reporting changes?
That's a great point. That is different than reporting changes. For reporting changes, you do need to have a record of that at the individual level. That somebody requested a change be reported, and yes, thank you. If anybody else would like to say more about that, I'm happy to turn it over.
And then I'm wondering if I can ask our policy folks, because there's a question that is, can you advise high level what issues have been discovered involving community partners and the lack of handing out these documents? And I saw a whole bunch of great verbiage, but I don't want to butcher it. So I wonder if one of you could speak to it.
Hey, this is Christy Garland. You can hear me still, is that right?
Yes.
Okay, great. So it wasn't, first out, I think one of the questions had issues that staff discovered. It wasn't that staff discovered CPs were not handing out anything. So I want to make that clear. It had more to do with when cases went to hearing. Administrative law judges really want to see the proof of what members signed or heard or read at the time of their application. And so we needed a process. That's why we need to document how we need CPs to document how their organization is going to be providing these rights and responsibilities in MPP. There were also things that came up in a hearing where applicants, members said like they never got their rights and responsibilities, or they reported things that weren't then reported. And so, and these were a few different cases. Oh, and I think the last time we heard about it was a while back, and that's when we started setting up this policy, started working with the Deanna, Jessica, and the team to set up these parameters about what could be done. Is that good? Does that answer the question?
Thank you. Thanks so much. All right, and here is a question. If I'm doing a virtual enrollment with a client and they're able to see the one screens as I do the application, is that enough for them to get the R&R and MPP info, or do I have to read all of it to them?
All right, I was muted. Sorry about that. That is enough. If they are reading it on a screen, whether it's sitting next to you looking at your screen or you are screen sharing and they are reading along, that works.
Thank you. Do people who are renewing or reporting changes need to go over the R&R and MPP?
People who are reporting changes do not need to go over the R&R and the NPP. When it comes to renewal, maybe we can have policy team chime in about what they are signing to and agreeing to. I don't know that list. And if they're agreeing to those documents, then if they've already reviewed them and want to say, yes, I've already reviewed them when I signed the application, my question to policy would be, is that sufficient? And does policy have anything else to add?
This is Christy Garland again. I I think they kind of got blended, the question. So at renewal, there is a responsibility that members, if they have received an active renewal, so that's the renewal that comes with the what looks like a mini application that they can use to report changes in detail. So for those renewals, we do need to have a signature, and the system will require it as well if you're doing it online. So they need to review the rights and responsibilities. So basically, anytime a signature is required, the rights and responsibilities are required.
And if they had already reviewed those rights and responsibilities at the time of the initial application, can a community partner say, would you like another copy of those? Would you like them again? Or do they need to review them anew?
They should be reviewed anew. The rights and responsibilities are pretty stagnant. I mean, they don't change all that often, but there could be changes to them. And also, you know, especially for medical renewals, right? It could possibly be several years before the person has that active renewal where they're triggered to look at the rights and responsibilities again. So if the system is requiring a signature, they should have the rights and responsibilities reviewed again.
Thank you. Let's see here. So talking about documentation, does the process of documentation have to come from our supervisor? I wonder if Deanna's muted again.
Yeah, no, I'm thinking. We haven't really specified where it needs to come from. I would say not necessarily, right? Like the assisters could get together and create that. We haven't discussed it, but that would be my off-the-cuff answer.
Yeah, I was thinking sort of, it's not necessarily important that everyone in your whole organization has signed off on it, but it should be something that all of the staff doing assistance are on the same page about and understand. So it's a shared understanding within your organization for the folks who directly touch these processes. Does that sound right?
Well said.
Let's see here. We have some folks having trouble finding the documents, and I think, to be honest, if there are, you know, if the form server or something like that is giving you trouble, the guide document that we have has direct links, so you are welcome to use that. But maybe also Yurok can go over the form server and make sure to answer any questions you have. I see some opportunities where maybe folks want to sit down with someone one-on-one. I'm going to recommend that if you are still pretty confused about how to find things or how to share them or what these documents are, that like, let's talk to you in another setting, because this could be, we might not be able to get everyone to the same level of understanding based on our short webinar, but we want to do our due diligence. So there's my little soapbox for that. People are asking if they need to submit their processes or documentation.
No, we are not asking you at this time to submit that process documentation, but to be ready to submit it if you are asked for it.
Someone's asking, I have given the Oregon.benefits email to clients so they can report changes on their own, but does the client need to use the secure OHA email? This could be a barrier.
I bet we can have somebody from policy address that.
I'm so sorry, Jessica. I was reading through all of the questions. Can you tell me again which question it is?
Yeah. So Amy asked if clients, like pretty much if clients are emailing Oregon.benefits on their own, about the secure email and how to help overcome the barrier of getting information securely to the state. And I can attempt an answer, which is, well, first off, secure email is a little bit evolving right now, so guidance in the near future could be a little different than right now. But if someone emails a non-secure email to Oregon.benefits, they should be helping people either by sending them a secure packet that they can then respond to, or like, so they could just send a sort of an opening salvo to Oregon.benefits saying they want to send secure information, and they should help them through that process. That's my attempt at answering that question. I hope that, is that helpful?
I'd like to ask a follow-up question, and it's for Joey. So I think, is Joey still with us?
Joey has been paying attention through our chat, but is not on this.
Okay, so it's a question about operations. If somebody, I mean, that email is out there, and if people surely email that email box with PII, with personally identifiable information, what does the worker do in the email box queue when they receive that, right? So like it happens. And surely the workers have a way to handle that. Like Jessica said, maybe they write them back with a secure email envelope. So it's to protect clients' information. It's not like it's illegal to send it that way, but it is best practice, and we want to handle private information securely. But I'm sure they know how to handle it if something arrives to them non-secure from a client directly.
Oh goodness, we have a bunch of good questions coming now. What if I know there are changes that need to be reported, but the client isn't reporting them? So if I know someone has gotten a new job,
Hello?
what do I do? Hello?
Hello?
Is that Adano?
That is not me.
Oh,
Oh,
all right then. I'm not sure who that is. Can we repeat that question, Jessica?
yeah, the question is essentially, what if I know things that the client has not told me to report? Should I be reporting it? Should I be reaching out to them? How do I navigate that? And I can say, like, as a member of the community, or maybe you have a different hat that you wear sometimes at work. So maybe you do billing sometimes, but you do the CP work other times.
I'm wondering if community partners can chime in about that. Anybody who might have experienced that and how they've figured out how to handle it.
And maybe while people are putting that in, I do want to re-up a question. So we spoke about the case of a deceased person who has an application going in, but we didn't write down the answer. And so I'm wondering, Edith, if you caught the answer we spoke about, which is whoever it is who is signing, that is the person who must have the rights and responsibilities and notice of privacy practices. So in the event of a case going in, for instance, for someone who has already passed away, that is our guidance. All right, and now
we can go back to this question of what do you do when you know there is a change, but it hasn't been reported? And Jessica, do you want to manage sharing some of the things that people typed or summarize?
yeah, I think, let's see, we only report on behalf of the client. It's their responsibility. We only report changes that have been reported to us. Changes in circumstances are a patient's responsibility to report within 10 days. If the client hasn't given us the info, we don't have it.
That's right. And it is not okay to report a change without that change coming from the client, right? That somebody said in the chat, and I've said it before, like you're not the morality police, right? You're a community partner that's there to assist a client in reporting changes. You can remind them that they need to report changes within 10 days and offer your assistance. But it's really their responsibility, not yours, ultimately.
Yeah.
But if you do feel like there is fraud going on, we do have ways to report potential fraud, and you're not pointing a finger at somebody necessarily saying, I think there's fraud there. What you would be doing when you report to the fraud line is to say, hey, this is something you guys might want to consider looking into. I don't really know what's going on, but just, you might want to look at it. So we do, I think, do we even have a webinar on reporting or we have something on reporting fraud that we could provide?
I think we do. Yeah, and it's also important, like when you are reporting something to be investigated for fraud. So, maybe like if that's something you want to do, you're welcome to. You are not required to take proactive steps for this. Yeah, we have a module somewhere. It's been a bit though.
Yep. Somebody says here they send them the responsibilities notice, the rights and responsibilities, and reminds them to report, and presumably says, and I can help you do that if you'd like. So I think those are that's all really good input. You cannot make the changes for them if they have not requested you to do so. Any changes must come directly from the client, not from the community partner, because they have additional knowledge.
Now, if they give you permission to report changes, absolutely go for it. I see that someone has written, I require them to do a written statement of a change that I have a record on file. And so that's a great possibility. We have a lot of good stuff. A lot of it's mostly in the same vein. I have a question about, does OHP pursue fraud cases? And the answer is yes. I don't know if policy has anything more to say about that. Maybe not.
No, this is crazy, Garland. I think, is there more to say on it? Yes. Fraud is pursued for all programs, including medical. And also, it's not just our state, the Office of Inspector General, like on a federal level, also sometimes, not necessarily from the fraud referrals we make directly, but they sometimes get reports that they also research. So, yes, it's researched and looked at, and depending on the what they find, it could include interviews, reaching out to employers, getting tax records. There's a whole bunch of different things that can potentially be done if to substantiate fraud.
Thank you. All right. I know that we have very active participants, which is awesome, but I'm also struggling to find all the great questions you all asked.
And we have about 8 more minutes. Is that
when will
right?
we get the? Oh, yeah. I think we end at 10:15.
Yep.
Do we have any news on when to expect the audio files to be available? I think fairly soon, right?
Ish. I'm not quite sure.
Do I remember correctly that they exist, but we just need to make sure we get them to you in a way that's going to serve you well?
Yes, and making them into that format and getting them into that place, whatever that place is. I don't know what the timeline would be on that. But yes, we're moving along. They were requested. We have been very actively getting them. They are here, and now we need to take that next step.
Let's see here. Are the rights and responsibilities and notice of privacy practices included in the renewal notice? I think the answer is no, but I want to double check.
So it depends. So there's a couple different renewal notices that go. So there is one renewal notice that is an active renewal, and I'm so sorry, I don't remember offhand if that is language that we active renewal, how we generally refer to it, if that's internal lingo or if that's something that's shared with this group. But what those renewals are the renewals that come that say that also include, like, it looks like a mini application. It's the 7310, and it's part 2 of the OHP renewal. It has all of the application questions, and the whole form doesn't need to be completed, but the person can, whatever change they have, they can answer on that form. So hopefully that's enough information for you to understand the type of renewal I'm talking about. That renewal does include the rights and responsibilities.
Christy, you're breaking up a little bit From my end, it's hard to hear you.
Same.
Okay.
So maybe someone else can pick it up then, because I don't want to have to reconnect just for that question.
Well, now you're clear, actually. We got you back.
Yeah, no, Chris, I think you got it. I think you got it.
Jessica, I'm trying not.
Yeah, we have questions that are, I think, out of scope, unfortunately.
Mhm.
So we'll tag those for tackling at another time. Regarding documentation of reporting changes, can each assister within an organization track document their own, or does it need to be shared within the organization? That's a good question.
It is, isn't it?
I think for me, it makes sense that people would document their own, but they should probably do so in a way where if you take another job,
Mhm.
the other folks who are doing assisting know where to find this information, and it's
Yep.
in a format that they could report it if asked to do so.
Exactly. It's about accessibility, not about the details about how it's done.
And you probably want to sort of try to right size that, where you don't want it to be something that everyone has access to if it's, not information they need. But yeah, it shouldn't be a secret that only you know. I don't know if that makes sense.
I think that's probably as good as we're going to get right now without being
We
overly descriptive.
do have a reminder that another way that people can report changes on their own is if they have their own applicant portal account. Sorry, I meant to mention that earlier, but I think it's something that is sort of implied, but we didn't explicitly say it outright very much.
Thank you for that reminder. It may not be an option for many clients, but for those who it is, it's really a self-sufficiency, built in, and it's great to help them access their own case for so many reasons.
I think we've mostly exhausted the questions. We've either responded in the chat or we've spoken about at least the broad strokes of the types of questions being asked that are on topic. I wonder if we want to spend a moment on recertification, since there were a few questions about that, and it is also important.
Yep. So I'm going to say, yep, absolutely. I'm going to stop recording